Good morning, everyone, and welcome to our Emergency Food Response, a Framework for Action session. While you're waiting, for those who haven't had an opportunity already, we invite you to write your name into the chat box located at the toolbar, in your toolbar at the bottom of your screen. And also, please include your name, a couple words about what brought you here today, and then include the territory you're joining us from if you know it. My name is Julie Leggett, and I'm PlanH Delivery Lead with BC Healthy Communities Society. And I'm joined here today with consultant Claire Graham. I'll do a land acknowledgement and spend a bit more time introducing Claire once more folks have joined. I'd like to take a moment to acknowledge that BC Healthy Communities offices are located on the surrounding traditional lands, the Kosapsum and Lekwungen Nation, where we work, live, learn, and play. And I see someone mentioned in the chat that from the Lekwungen territory, where spring has finally arrived, and I would agree with that. Thank you for saying that. All right, let's move on. So we have a jam-packed hour and a bit here for you. And thank you again to those entering who are able to enter your name in the chat. And I see we have people from many places across the province. Just a quick reminder that today's session is being recorded and it will be up on our website later today or tomorrow after we finish up here. As a registrant, you'll also receive a follow-up email that includes the link shared today in the chat, a recording of today's presentation, and the slides. I'd like to take a moment to say special thanks to our tech team here at BCHC, Yvonne, Abby, and Jody, who'll be working with us behind the scenes today to ensure that all things techie run smoothly for us. During today's session, you'll see the chat will be fairly active as they'll be chiming in with related links and resources. Also, if you have specific questions about the BCHC organization and or a PlanH program, or questions of our speaker today, please use the Q&A function, also located at the bottom of your toolbar, but separate from the chat, to enter your questions, and we will address them at the end of today's session. We'll also be live tweeting today's event, so if you can follow along and jump in if you like on Twitter using the hashtag noted on the agenda here. We anticipate that today's formal presentation will take about 45 minutes, following which we invite you to stay for the question and answers. We're going to close the formal presentation around 12 o'clock, but extend our time for about 15 minutes after. And we know some people may not be able to stay beyond the formal presentation. So if you need to leave prior, we invite you, as you go to leave the Zoom, to click on the survey link and provide us not only your feedback of the presentation, but also indicate if you're interested in a potential opportunity to provide further feedback on the development of this framework. So during the course of our time together, I'll spend a few minutes initially just talking a bit about BC Healthy Communities, what we're about, and a bit about our PlanH program. Then I'm going to hand it over to Claire, who will share information and a framework, a draft framework we've been working on together that looks at developing an action resource to help support local and Indigenous governments' emergency food response planning. As I mentioned, we always leave time for questions at the end of any webinar. However, given this framework is really in its formative stages, we want to hear and encourage your questions more than ever. So as I mentioned, if you're able to stay on and even beyond the 1 hour for a few more minutes, that would be wonderful. And if you have to leave, there'll be an opportunity in the survey to enter your contact information that we can follow up with you. Okay, next slide, please. So just a little bit about BC Healthy Communities and the PlanH program. BC Healthy Community Society has been around since 2005. It's a province-wide not-for-profit organization that facilitates the ongoing development of healthy, thriving, and resilient communities. We at BC Healthy Community Society believe that it is possible and really necessary to create communities where it's easy for people to be healthy and well. So we really look at it from a holistic approach, and we operate at the intersection between planning and public health. Next slide, please. Since 2012, PlanH has provided cash grants and in-kind support to communities with a total to date of 225 projects funded around the province. Our PlanH program for local and Indigenous governments provides support to local government engagement and partnerships across sectors for creating healthier communities. At PlanH, we provide learning opportunities, resources, and leading edge practices for collaborative local action, recognizing that community policy, plans, and decisions affect health and well-being. And we do all of this in partnership with the Ministry of Health, supporting the province's health promotion strategy. Next slide, please. Okay. What I'm probably going to say here is nothing new to anybody who's joining us here today, but just to give you a bit of background and a reason for why we're bringing this to you today. Within BC, we have recently experienced an accelerated number of diverse emergencies, such as fires, floods, heat events, and of course, we've all experienced the pandemic. We anticipate a continuing variety of compounding emergencies and worsening outcomes, largely due to climate change. So looking throughout these diverse emergencies, local and Indigenous governments, those community agencies, health authorities, and other levels of government who support them, have expressed challenges when it comes to knowing how best to support community groups who face greater barriers prior to the emergency events, and then those being the groups who are typically most hardest hit in a new crisis. So to help prepare for these oncoming challenges, local and Indigenous governments are looking for tools or resources to help support this piece of the emergency food response and to ensure that their interventions reach those in communities who are most in need of these resources in such difficult times. So when we look at drawing from our recent experiences, the literature and legislation that guides local and Indigenous government decision-making around emergency response and planning, we really looked at it and said, you know, there's opportunity here to dig a little deeper, to better understand and co-create a tool or resource around an equitable framework for action to address these unique and complex challenges. Next slide, please. So when we look at the literature, there's a growing body of literature that documents the intersecting social inequalities and how they materialize in negative health outcomes for people who are disproportionately impacted by emergencies. And while socially determined inequities create ranging and unique needs in a community based on its membership, the literature tells us that there are common groups across BC who face greater barriers to accessing emergency services, including food, during emergencies. The social determinants of health, such as income and food insecurity, are all factors that influence positive, healthy outcomes in populations. And while we all know emergency planning exists and it's not a new concept, applying an equity lens to emergency planning, particularly around food in what we're talking about, and taking action towards the social determinants of health, puts human resources, shared political commitment, and financial backing behind this kind of systems thinking. Next slide, please. I know you all didn't come to hear me speak for the next hour. So at this point, I'd like to formally introduce you all to Claire Graham. Claire is principal at Clarity Consulting. She holds a master's degree in community and regional planning. And prior to Claire venturing out on her own recently, she worked for over 25 years in public health in BC. In her role at Vancouver Coastal Health, she was a population health lead supporting food security work locally, regionally, and provincially. Claire also played a key role in the emerging fields of healthy built environments, healthy social environments, social connectedness, arts and health, and healthy public policy and systems thinking. Claire's extensive background affords her an understanding of these complex and unique challenges around food in emergency response planning. And we're really excited, and I've had the opportunity over the last little while to work with Claire, and Claire's been a part of our team, and we're excited that Claire will continue on with us as we work together following this webinar to further develop and finalize this resource later this year. So without further ado, I'd like to hand it over to Claire now to speak about the work that she's been doing and the emergency food response, a framework for action. Over to you, Claire.
Great, thank you, Julie. And I want to acknowledge that I'm zooming in from the traditional unceded territory of the Coast Salish people, the Musqueam, Squamish, and Tsleil-Waututh, and that I'm also coming in with a measure of humility, looking at all of the amazing participants that we've got here and the cumulative experience that's on this Zoom today, I think is remarkable. So I want to acknowledge that I'm bringing some initial early thinking to trying to sort out some of the challenges in this sort of messy, sticky area of the emergency food response. And I want to, the focus of this work is to support local and Indigenous governments in their response. But as local and Indigenous governments are not islands unto themselves, they're part of systems. And so I can see from the participants, we have many agencies and organizations at the local, regional, provincial levels that support the work that happens within each community. And I think I will be speaking to that sort of systems approach in this workshop. So pleased that there's so many people here from different roles. I remember hearing about from Disney that in the Disney School of Management, if you're not serving the public, your job is to serve somebody who is. And I think that's exactly the case for here. If you are not in the local government or the Indigenous government doing this work, then what's your role supporting that? What I'm going to start with is a little bit of reflections on what happened during the pandemic. So I left VCH before some of the other emergencies, the heat dome and the floods. I think most of the thoughts here are easily transferable, but I want to reflect first on what I saw happen, and hopefully this resonates with your experience. What I saw was when the pandemic was declared, there was unbelievable, impressive mobilization of resources, planning, whole organizations switched on a dime, the structures of organizations, the communication patterns, everything switched up, and at all levels. And at the same time, when all of that great energy was going, all of the existing network type meetings, all of the regular coordination meetings that kind of tie what happened with community groups, with local governments, and even within agencies were were canceled. And so it kind of broke up the communication patterns very early on. What happened, of course, is that started to rebuild. And I know many community organizations started to work. At first, there was a lot of churn. There was people all head down. What can we do? How can we do it? What do we need to know? And in an emergency, there always is churn, and acknowledging that will always be the case because it is the unexpected. But what started to emerge is people realized they did need to stay networked. They did need to hear what was happening with other groups. And so many not-for-profits started that somewhat informally. Same with some local governments started reaching out to the varying community groups. Sometimes that was hindered because of redeployments, so that the normal contacts weren't in their positions. But then it started to get a little bit more formalized again, and you could see at Metro Vancouver, the social issue subcommittee reconvened with all the social planners across Metro Vancouver, specifically around the food response and how they were handling it, what the problems were, what were common across communities or unique to communities. There was a similar one in Sea to Sky, and it was really the initiative of the resort municipality of Whistler who pulled that together. And interestingly, the person tasked with that had been redeployed and didn't have any previous experience with the social service sector at all. Central Coast, again, it was different. It started to create under the guidance of some of the VCH staff with the community members that are most engaged with food services, and they created a whole advisory, including the grocery stores. So I think across the province, that process happened, is things kind of fell apart and then rebuilt as was needed. In my role, I was very fortunate to be able to, at a regional level, to be able to sit in on some of these community groups and to help at times share that information at higher levels of organization, be at the regional level when I presented to the Metro Mayor's Advisory Committee on the food response, or able to connect up with their colleagues at the Ministry of Health and the Vulnerable Population Food Working Group. So being able to kind of channel the communication from what's happening at the ground to what was happening regionally and provincially. But I think what struck me most was that was not systematic. That happened, and that was great. And there was so many people doing great things, but we didn't have good systems for making sure that happened on a regular basis. There were other examples where some of my colleagues were at PCH were able to connect. Vantage Point did a tremendous job trying to connect with not-for-profits across the province and help coordinate some of that, some of the survey work. And again, so there was a lot of good work as we rebuilt some of those communication structures, but I think by doing it more intentionally, I think we can do that better. And I think that's the heart of what this presentation is going to be all about. So there's a few caveats. I haven't worked in emergency planning itself in the field, and I didn't sit at any of the emergency operation tables. So if I mischaracterize any of that work, please let me know. There's also so much experience here on the call. And each community experience some of this somewhat uniquely. So I think I really want to make sure what I'm aiming for is that some of this resonates with you and provides some utility. It's really emergent work. And so we deliberately started this process to present it relatively early on. And as Julie mentioned, we'll be doing follow-up afterwards to kind of build it more robustly. So feedback, feedback, feedback. Love to hear from you. Next slide. The structure of the presentation is that I'll talk just a little bit about the importance of the equity lens, and then I'll look at what does using an equity lens for the emergency food response, what will that look like? And then I'll recap some of the key action items as I've seen them, and towards the end. Next slide. So why do we need it? And I think what was given the strength of emergency planning is a very powerful, important tool for simplifying and making efficient decisions, really coordinating communication, decision-making, resource allocation, really looking at the big picture. How do we keep our systems functioning? And I think that's that's the big piece and critical piece. The challenge is when you're trying to work with people with pre-existing vulnerabilities, and I'm going to flag that we've had some challenges with the wording around people with pre-existing vulnerabilities or the term vulnerabilities. And so I've tried to explain more further on what I'm meaning by that, but if there's a better way of articulating this, please let me know. We've struggled a bit. And as Julie mentioned, people with that are already facing obstacles to equitable engagement in our communities often bear the brunt of the worst outcomes during an emergency, both in terms of physical health and mental health, and probably economic health. So we felt that this piece, though, it's not just about being more efficient with a checklist to do the work, but that it really requires a different approach. It's very micro. If you're really looking at who are the individuals that need more help and who are the populations of people that need more help. And then you need to get right into the kind of understanding the community and understanding who's there and who needs help. And that's very relational. It's working with organizations that already have pre-existing relations with some of these populations. It really is more of a relational approach. So where emergency operations covers the macro approach, the essential macro approach, the equity lens is a component that adds a micro approach. And so what we've done is position that as a piece within emergency operations. And this webinar is about the emergency food response, and an equity response would go beyond food, including, housing, transportation, many other dimensions, but it will always include food, and food is always a substantial portion of that. Next slide. So who are we talking about with when we talk about applying an equity lens? And again, there's variations in community and variations in types of emergencies and who is hit hardest. But by and large, there's some fairly consistent patterns. Unfortunately, it's people facing racism, people with lower socioeconomic status, people whose living conditions are of lesser quality, people age, so the older and the younger populations tend to be disproportionately affected. Geographic location is key, and that depends a lot on the different what kind of an emergency. Occupation zone, again, we really saw this through the pandemic with grocery store clerks and frontline workers, as well as the healthcare workers. People whose health status is already compromised, people living with chronic diseases or language barriers. So there's a whole range of different populations that will be affected differently. And so it's not a one size fits all for how to reach them. And that's why I say it requires the micro approach. Next slide. And so I kind of hinted at this before. What does it mean to apply? And I'll go through it in more detail when I talk about the emergency food response. But it really has to build on social capital. And I noticed there's a lot of community organizations who are here today who did tremendous work through the pandemic, and as well as local and Indigenous governments, and kind of how they did it. But you can see that reaching these populations most effectively requires knowledge and relationships with them. So for an emergency response, it needs to work with informal and formal community leaders. And so you need that work at the ground, but that information, that knowledge and those networks need to be also networked vertically, so that the information gets shared at regional and provincial levels in a systematic way. And I think that's the piece that one of the pieces I'd really like to emphasize. But in order to build those the networks and connect them both vertically and horizontally, is you need convening roles. And so I'll talk more about that as well. Next slide. So this is kind of the very quick sketch. I kept calling it the sketchy sketch of what I'm talking about in terms of situating the equity lens within the emergency response, but have that paralleled, hopefully, at a regional and provincial and national levels, to make sure that there are networks of support at each level. And then I'll walk through the sort of what can be done before, during, and after. And I acknowledge that a lot of this, again, is very early days on it. So I'm throwing out a lot of pieces, and hopefully they will still resonate. I know there's much more work to be done on it. Next slide. So before an emergency, really, because of this micro approach, it's about building relationships and about connecting those relationships from the Indigenous and municipal governments. And so, you know, who's the staff person who is most connected to that? And depending on the size of community, that role might be somebody who is a dedicated social planner, or one of several dedicated social planners, as in the case of Vancouver, to just somebody who's got their finger on the pulse most within that organization. But identifying somebody who's kind of the key link to support this work. And then knowing how to connect with the existing multi-sectoral collaborations and partnerships. We don't need to build this from scratch, especially during an emergency. There are already many collaborations and partnerships. And in the food sector, I just want to acknowledge that BC has actually got a pretty vibrant sector supporting food security at many dimensions. And part of the credit for that, I'd like to give to the Ministry of Health for continuing to fund projects like Community Food Action Initiative and others that fund local community groups to really address food security at the local level. So there's a vibrant network that already exists. And some of that's at the local level, like most of the CFAI funding goes to, but there's also organizations at the regional and provincial level that provide a lot of expertise. And again, just flagging this issue of secondments during an emergency, pay attention to which staff are most connected and make sure they don't get seconded somewhere else. There's a lot of work, and I think in traditional emergency planning around mapping community vulnerabilities. And there's been some great work mapping exposure sensitivity and adaptive capacity. And I'll talk a little bit more about that in a bit too, but really understanding the layout of the community and the organizations, as well as mapping the assets. The assets are almost more important in my mind than the vulnerabilities. Making sure you know who are the community organizations, the hubs, the faith-based groups, the cultural and linguistic leaders. Having a bit of a spreadsheet with the names and phone numbers is really important. But I want to acknowledge that mapping is a really tricky exercise that goes out of date as soon as you say it's finished. And so that kind of comes back to the importance of the relationships, so that if that person isn't there, you know enough to know who else to connect. And so when you do your mapping, make sure that you go in with the explicit goal of building relationships as well as doing the mapping. Next slide. So this comes from some of the work that has been done through UBC together with BCH and Fraser Health. This is really exciting work looking at mapping climate and health vulnerabilities. And they define vulnerability in a way that I think is much more useful. Is they talk about vulnerability equaling exposure. So how likely are you to be exposed to the flooding, the air, the wildfire smoke, the heat, how likely are you to be exposed? Then the second component of it is the sensitivity. And here they say age. So again, the older populations as well as the very young are usually the most negatively affected. But combined with that, people living with chronic conditions. If you've got asthma, of course, the air quality matters. You've got more sensitivity to even lower levels of exposure. And the last one, which I think is really brilliant, is the adaptive capacity. And so you're looking at people with the structural inequities and marginalization. So people already facing those barriers. And that can be due to socioeconomic status. It can be the physical environment, including housing. It can be issues of racism or other isms that interfere with people being able to access the resources that exist for more well-off people in the community. And we're talking here, when we're talking about the health impacts, we're talking both physical and mental health. And so I think that's important to consider. Next slide. So another thing which I felt in some of the emergencies was maybe not quite as sharply articulated as might be useful, is really defining what type of food issue is it during an emergency. So when we talk about food, most people just think, okay, there is no food, we need to get food to people. But I think doing a little bit more nuanced look at that into different types of food issues during the emergency helps create a more efficient and effective response, so that really we can get the most food to the people who need it most with the least effort or least waste of effort. And so the first condition that I wanted to flag is availability. Like, is there food in the region? If there's no food in the region, this is the kind of issue that emergency operations handles well. That's a kind of macro issue. We need to get food into the region. The region's been cut off, the highway's been cut, the supply chain's broken. We need food into the region, and emergency operations is well prepared on that. They've got the 3-day window that they work with. I think so. I'm going to leave that with emergency operations. The trickier one that comes up often is accessibility. So when there's food in the region, but there's distribution problems, is it getting to the people who need it most? And what is it that they need? Is it groceries? Is it meals? And do they need it? Are there people who need groceries and meals delivered, but can afford it, versus people who need groceries and meals and can't afford it? And kind of parsing out a little bit the strategy based on those quadrants, and to make sure that people are getting what they need. The piece that's kind of in here that I think is an additional piece of work that needs some thought is the anti-hoarding policies vis-a-vis when an emergency is declared. And so sometimes when an emergency is declared, grocery stores do implement right away anti-hoarding policies that keep people from buying the whole shelf of eggs or all of the food off the shelves. And I think in some cases that happens immediately. In some cases, there's a bit of a lag time before that's implemented. And so I was thinking that it is an important equity consideration to make sure that those who either can't afford to really buy up a lot of fruit, groceries, have access, or people who haven't had the time or are located further away and therefore can't get to the grocery store. So some equity around that with the anti-hoarding. But it's also really critical to recognize, and I heard this a number of times before, that the anti-hoarding policies that grocery stores implemented really disadvantaged some populations that needed some of the access most. So families, especially from communities that have to travel into the grocery store, that have to travel great distances, people shopping for others in terms of helping other people with their accessibility, people who have large families, and people who are, I remember hearing it was also group homes and stuff. So for me, it just seems like there's a piece of work that could be done working with the grocery store retail association and representatives from different communities to cobble some voluntary guidelines around hoarding. So when they should be implemented and how to manage some of the exceptions. The third category is affordability. So it's when there's a sudden rise in the number of people who can't afford food. And what's interesting with this one is that the response tends to be to really fund food banks for this. And I think food banks are an important part of our food ecosystem and play a hugely important role. But when it's an income-based challenge, and we saw that with SERVE, it can simplify some of that. Moving food across the region requires warehouses, trucks, refrigerators, freezers, a lot of infrastructure, whereas a grocery gift card, you don't need a truck for. For people who have been shopping quite successfully on their own for a long time, they don't need bags of food. They need some income to afford it. So I think teasing out where is it appropriate for the food bank, which has a critical role, and where is it that we can provide other forms of assistance, more income-based. And the fourth category here is displacement, and when a whole community is evacuated. And I think then you go back to the first three and see, okay, with those populations that have been displaced, is there food in the region? Is it accessible? And is it affordable? Next slide. I also want to really make the case for remote communities, because I think there's a lot of, I think that many of these communities are more vulnerable to food insecurity all of the time, notwithstanding any emergencies. And they have pre-existing access and affordability challenges. I was speaking to Jess and Bella, who said we are always 2 barges away from food insecurity, from not having food in the region. And I think that's true for many communities that are subject to road washouts and other forms of disruption to the food supply. Also, food in those communities is a lot more expensive. It takes a lot more to get up there. And many communities are ones where there isn't the income to allow individual households to have a well-stocked pantry in case of emergency. So I think we really need to look at the case for remote communities and what can be done. They also faced, in many cases, from what I heard, they bore the brunt of some of the anti-hoarding rules. So I think need to be part of any follow-up on that. That said, those communities that exist in remote areas are very resilient. That's how they live as well. And in so many cases, since time immemorial, most of these communities are Indigenous communities and have lived there forever. And so it's really important that we build on the resiliency within them. In small communities, there's not as many of the formal organizations that you find in larger and larger scale communities, but there is informal networks. And in order to know how to support these communities, you need to know how those informal networks work. So you need to be able to work with people in the community and have them help you understand what's the best mechanism for getting food in, who's the best person to contact in the case of this. You need that inside knowledge often for how to work with different communities. And another piece that I think is really growing, I think I was noticing it when I was at PCH over the last sort of 5 to 7 years, of much more work building partnerships between Indigenous communities and their municipal neighbors. And I know UBCM has had a grant for this, and the grant was there for a long time, but it's really had a big uptick in demand for it. And I think there's been some very powerful work starting to build those partnerships back. But emergency food response is another area that fits nicely with. The ability of getting food into the region and where it goes and how it goes, I think you need to have those partnerships. And I also want to flag here the issue of special diets. And actually, I could put this anywhere in the presentation, but I was really struck again when I was speaking to Jess and Bella, who had done a survey, and 56% of the households had somebody with a medically restricted diet. So again, this speaks to the need of the micro knowledge required to be able to really meet the food needs of people during an emergency. Because if you are able to bring food in and you say, tick, food is in the community, but people can't eat it, that's a real problem. Then you haven't solved the issue. So really understanding and being able to know the needs of the community. Again, it's that micro knowledge that needs to happen and then needs to be shared. Next slide. So mobilizing during a community, it's really establish that convening role, who's able to help. And that can be a local government role, that could be a health authority, that could be a not-for-profit organization. Often that emerges naturally, but it helps to have thought about it a bit ahead of time and then see how that can be supported. What I want to flag is the role of not-for-profit organizations is critical to this equity response, as you've seen in how I presented this. But I know during many emergencies, they lose their funding as well, or they lose some of their funding. And so it's really important to make sure that you check on your community partners to make sure they've got what they need to be able to keep supporting the emergency response. Establish an equity advisory committee parallel to the policy advisory. So under the Emergency Act, it allows local governments and Indigenous governments to create a policy advisory to inform that macro response. And that's a critical piece. But it also allows under the Act for other advisories. And so what we're saying is establish an equity advisory committee that's kind of part of your emergency response, and make sure that there's coordination with the emergency response. So I know in some of the cases during the pandemic, I was a part of what I'm now calling the equity advisory, but there was no overlap with participants with the people who sat at the emergency operating center. So making sure that you built in the connections there. And then again, look at how you can connect to the other regional and provincial networks. Next slide. And I'm close to done for this very long, throwing at you a lot of information. It's really important to maintain the relationships. One of the things here I've got is building data systems. And this can be done, the after is really the before, as we've seen lately. It's no longer that you do an emergency plan and it waits 10 years on the shelf. Ooh, these are actively in use. So the building back is the building forward, and you need to maintain the relationships and build some data systems so you can see how well people are managing after the fact. But also there's an opportunity for, and again, this can be before, after, during, but there was a lot of survey work going on. There may be an opportunity to identify some core questions so that the survey work can get rolled up and you can see, have more common understanding of the outcomes. And take each opportunity to build back better. And it becomes trite, but try and reduce the inequities each time we're building back. Next slide. So this is the last big meaty one. Actions for local and Indigenous governments. Before an emergency, identify potential representatives for an equity advisory committee. Map the community vulnerability, exposure sensitivity, and adaptability. And I know this is much easier for the well-resourced, bigger communities. And so I say this to the broader network of supporting agencies and organizations. How can that work be done and supported in smaller communities? Mapping the community assets and the resiliency, and work on some of that anti-hoarding volunteer guidelines. During an emergency, identify the convening roles, establish the advisory, and collaborate and figure out how to network it in with local, regional, and provincial groups. And if you're at the regional level, make sure that you establish a landing place for that information. If it's not an equity advisory committee, it could be. Make sure you've got a landing place for that information. Fund community leaders and organizations so that they can continue to support the emergency response or ensure that they have the funding available. And identify the type of food response required. And after an emergency, when you're working with populations that are disadvantaged before the emergency, they will take longer to recover, likely. And so emergency operation centers often will be dismissed and go back to regular operations sooner than some of these populations will have been able to transition. And so making sure you've got some mechanisms for staying in touch. Next slide. So Thank you. I acknowledge that I have thrown a lot at you. Some of it's more thought out than others. Love to hear your responses.
Thank you, Claire, so much. We'll go on to the next slide, please. Thank you so much, Claire, for your time and for sharing so much rich information. I know there was a lot of content in there, but really pulling this all together into the beginnings of a beginning work around a draft framework for equitable emergency food response. A couple key themes for me just before we get into the questions was just around the importance of the different needs, the different approaches within an emergency management structure. And then that word relationships, the importance of building and supporting these, working together and engaging those most impacted at each stage, the before, during, and after, and the building back after an emergency. And finding ways, like Claire mentioned, around establishing advisory committees to bring these components, the lived and the learned experience and the expertise to the policy and decision-making tables. It really goes a long way to ensure an emergency food response that works for everyone. Okay, next slide, please. So as we mentioned a few times throughout the presentation, this framework is very much in its conceptual stages, and we are really welcoming and inviting community questions. I see there's some filling up in the Q&A in the chat box now. Really appreciate that. And also there's another way, again, as I mentioned earlier on in our post-webinar survey. So as you go to leave, there'll be a survey link. If you click that on, provide your feedback. And if you are interested in potential opportunity to provide some more feedback on the development of this framework, there's a space there for you to enter your contact information, and we'd love to hear from you. Next slide, please. Just before I jump into questions with Claire, I want to mention that our PlanH Healthy Communities Grants program is open for applications. And we have two funding streams. One is the community connectedness grants for up to $5,000. And the other one is the healthy public policy grants for up to $15,000. The deadline for submission is June 1st. And I see Abby has just posted in there the link that you can go to find out more information and to apply. And also important to note that each grant comes with the funding as well as in-kind support from our staff. So we look forward to having a look there, and we may see an application from you in the near future. That's great. So we are bumping up to 12 o'clock, and so that sort of ends the formal. We can move on to questions now. The question slide, thank you. So it ends our formal presentation, and I see there's many questions in the chat that we're going to start with. We knew there would be a lot of information in this, and recognizing people's time and other commitments, we did want to add an additional time to this webinar in hopes that people can stay about 15 minutes, and I'll begin shortly with questions. And we know, however, that some of you may not be able to stay. So again, if you're able to enter your questions into the chat box, and or as you leave, entering them into the post-webinar survey, that would be wonderful. For those who have to leave us now, thank you so much for attending, and we hope that the information in the presentation was useful in the context of your work. And again, we just really want more feedback and input. So whatever you've got, we're open to hearing. So, all right, Claire, you're ready to go here without, we have several questions here. So this first one actually comes from, we don't have a name on the person, but just a comment around how important an equity lens is. And how does this framework apply? I know you talked a bit about remote communities and smaller communities, but do you have other information that you can share around how this framework applies to smaller communities?
Yeah, I mean, sometimes when you're thinking about this kind of work and the network of organizations, there's many fewer organizations, and there's many and much fewer staff within local governments. And so it may not be, depending on the size of the community, it'll take a different form, but sometimes it's a role rather than a committee. Sometimes, so it'll play out quite differently in different communities. I think in terms of some of the mapping, there may be additional, um, uh, using some of the, say, PlanH grants or other grants available to do some of that work ahead of time is important. But I just want to acknowledge that there isn't the resources of a big municipality to do all this work ahead of time, and it makes it can make that more challenging.
Great, thank you. Next question from Neil. Do you have any comments on the potential impact of GAI on equitable access and what we in the NPO sector can do to advance this goal?
GAI.
GAI, yeah. Are you able to, do you want that spelled out, Claire? Would that
would help.
Yeah. Neil, are you able to provide the full wording on that? And maybe while he's doing that, we could move on.
Guaranteed annual income.
Okay, good. Yeah.
Yes. So much of what we call pre-existing vulnerability does come back to socioeconomic status and availability of resources. So whether or not that's the guaranteed annual income, or if it's something like CERB, reducing the pre-existing vulnerabilities is beyond the scope of this project, but is what would make this work so much easier, quite frankly. The fewer people we have in that vulnerable category, particularly around adaptive capacity, the easier this work is. So there's no question that addressing some of the socioeconomic disparities, and quite frankly, right now, we're seeing those grow, which is very disconcerting, and I think makes adding this equity lens even more important as we go. So I think that that's a critical piece. And we talked about how much do I go into that for this presentation, but it is the biggest. It would have the biggest impact.
Great, thank you. Another question here from Jill. Will roles of various partners involved be defined in the framework? Are we going to get more detailed in the framework around roles of the partners? Thoughts around that, Claire?
Possibly, but it's tricky given the variety of communities that exist. So I think the equity framework has to sit within the emergency operating of any community, but the actual roles are likely specific to each community. So we can talk a little bit more around, and even in terms of making sure not-for-profits are funded to support some of that work. Like it isn't necessarily a local government's role to fund that. It's to share the information to provincial sources, as happened during the pandemic, to ensure that there was adequate funding underway. So it's hard to nail down exactly whose role is what in advance. And that's where the local knowledge really is essential, because part of that is knowing both the informal and formal networks that need to be engaged.
Thank you. One comment and question from Marita. Thanks so much for this presentation. Both Lush Valley and our CV Food Policy Council saw how vital it was to have developed relationships prior to an emergency. Thank you for that comment. And I'm really interested in hearing, that relationship building is emergency planning, which is great, because sometimes the aspects of this work can be deemed less important than other work. Okay, question. How, as a nonprofit, can we encourage our local governments and provincial governments to look more deeply at equitable access of food in emergencies, specifically around funding to support the mapping and baseline information and encouraging the right policies? Thoughts on that, Claire?
Well, I think there's probably a variety of ways, and that's where forums like this are really important, is that the role of the not-for-profits and some of the organizing that they do, and organizations like PlanH that do such an amazing intersectoral collaboration. I think that's where the conversations have to keep happening, and to work with all of the different layers. This is where the network has to go vertically as well as horizontally. The local government needs to know, but they're not likely to be the ones that will be doing the funding. But they can say, in order for us to do this, they say to the regional authority and further up to the sources of funding, which are more likely provincial. So the more we can build an understanding of what this equity piece looks like and what is required to make it work, I think is how we do that. So it's continuing to share this information, continuing to build opportunities of understanding what this emergency food response is and what adding an equity lens is within that.
That's great, thank you. And I'll also mention here, there was a question around this as well, around BC Healthy Communities Equity Resources around food response emergencies. And I'll just mention that they've been around for a while, but many equity related resources can be found on our PlanH.ca website. And of particular importance or interest perhaps to the participants on this webinar were the Rapid Action Resources, a series of resources that were developed early on in the pandemic by BCHC staff, and through research identifying needs of and asking sorry, I got some on my throat. Research to identify needs of local and Indigenous governments during the pandemic, and the food security and insecurity came up as issues that were identified. And so staff here at the BC Healthy Communities explored this and created some resources, including offering ideas for local government actions around food security and insecurity issues from a healthy community lens. So I encourage you to look on the website as well, and that'll be included in our links too. So just to know that there are resources out there for sure to have a look at. Okay, so let's see, there's many more questions coming in. Thank you for these. Great work. How will these recommendations be communicated more broadly? In particular, thinking of funders and other funding resources to support remote community capacities. So maybe Claire, within that, talking about, another question was around advancing the next steps for advancing this. So maybe talking about that more broadly as well.
Sure, and we have a question in the evaluation, and it's a really critical one, is what do you think is needed to be able to build out this idea, like to be able to make this more useful? And if it's communication tools, please let us know. So what we'll be doing after this is we have committed to meeting and seeing how we can package this a little more thoroughly. We know there's additional pieces that probably will need to grow over time. But what do you see are the most urgent pieces to be taken on at this point? We'll be doing more consultation making sure, trying to work out different pieces of it. And at this point, we probably, we will have the next stage of this likely finished in about 6 months. We'll have to define exactly what that next stage is and then see from there. So it is emergent work. It's really helpful to hear what you think is most important for being able to move it forward.
Okay, great. Okay, so one more question here. How would you group each government's, so federal, provincial, and municipal, leverage based on type of emergency as you've described? I'm not sure if you can answer that one in short time, or we have a few more minutes, but
I'm just how would can you read that again?
Sure. How would you group each government's leverage? So kind of their role or involvement based on the type of emergency as you've described. So looking at those availability, accessibility, those types of emergencies or within those emergencies.
Well, I think the sort of at the local and regional level, the primary responsibility is knowing what the needs are and communicating those, and then being able to help the resources and the requirements get to the people they need. At the provincial and federal levels, really, there's a whole lot around bigger levels of policy, bigger levels of and resourcing. In between, like at the regional level, there's a whole lot of work around kind of taking the individual stories and knowledge of what's happening in each community and being able to knit them together to make a bigger, to be able to say, this is actually something quite significant that needs to be addressed. So it's kind of the collating of stories and intel from the communities that happens at that regional level that really supports the communication to the levels of government that have more funding to support it. So I think each level is really absolutely critical in the chain. And that's why I say really finding explicit ways of networking vertically is as important as networking horizontally.
That's great. Thank you. We have 5 minutes left, so we have time for 1 or 2 more questions. And I have one here from Kathleen. Around an equity lens, where does cultural safety, anti-racism, and trauma-informed approaches get built into work before and after, during relationship building?
Absolutely key, because those are in many ways the conditions that make people have less adaptive capacity and less ability to take advantage of the resources that are provided. So it has to be built in, and that's where it's important to build that in at all levels of the organization. And I think from the whole emergency operating center, there has to be an awareness of those informed processes. But that's where the communities on the ground generally have much better experience working with the diversity of communities and working with organizations that specialize in some of those areas. And so I think it's a key piece, because that's part of the problem.
Great. Thank you. And thank you for everyone for your questions here. We have time. So this actually might be a good one to wrap up with, Claire. So Jill's question, and how can I provide feedback and be involved in further development of this resource? So really happy to see people are interested in getting involved with this as well. So Claire, do you want to?
Sure. Again, in the evaluation, there's an opportunity to say if you would like to be part of that follow-up. And I think it's going to be critical for really moving this from such a initial beta version to something more robust, is being able to work with more communities. So really keen to find out who's interested and able to support the ongoing work. So again, in the evaluation, please put down your information and we'll be able to follow up. We're still just sorting out what exactly that looks like and what we've got the capacity for. But we will definitely reach out to everybody here and let you know what the next steps will be.
That's
I believe
great.
I can say that, right? Julie,
Yeah,
we'll be able to send a notice to everybody and say what the plan is.
Yeah, we'll keep the community up to date, but for sure in the evaluation, it's those people who are interested in kind of that next step, that further development piece. Those for sure are people that we need to hear from at this stage, and then as we get to the final stages, then we'll disseminate it more broadly, the final piece of it for sure.
And I didn't mention it, but I do think there's a number of pieces, some of which we'll be able to take on, but some of the pieces that I think are yet to be done is there probably needs to be a bit of a working group for rural and remote communities to kind of better look at how to support them in the case of an emergency. There's a data piece, there's a piece on just the communication of this to make sure that's shared more broadly. There's work around what does mapping look like and what are some of the tools on that. So there's a number of different pieces. And again, love to hear from you what you think is what's most urgent.
Yeah, and so thanks for that, Claire. We're just going to wrap up now because we have about a minute left. So again, just a reminder to click on the survey link, fill out the evaluation form, and if you're interested in further being contacted for further involvement. And thank you again so much, everyone, for joining us today, and especially to Claire. Thank you for all your work and your time and your efforts that you've been putting into this. Most appreciative. And we're so happy to be able to work with you. Have a wonderful day, everyone.
Who's worked with me before knows that this is an area I'm very passionate about. So I'm so delighted I've been able to work on this.
Thank you again. We'll see you later, everyone. Bye for now.